With you on SportsCenter, breaking news: Kobe Bryant could be done for the season. An MRI today revealed the injury that he sustained last night. The team announced he's flying back.
You take your shirt off. Chin here. Chin on your chest. Okay, put it down. Do the right one. Does that hurt? Stamina?
My left shoulder.
Yeah.
Shoulder was just bad.
At the end of the game, it wasn't.
Shots felt fine. It felt good. It just and when it came, it was I couldn't do it. I mean, there's nothing I could do.
So the thing that I can't tell is how long you've had this injury. This is your shoulder, the ball in the socket, the deltoid's removed. Okay, your head's facing this way, and there's 4 muscles for your cuff. There's 1 here, 2, 3, 4. Unlike these previous MRI and your ultrasound that you had a couple months ago, this is pulled off, torn and pulled off. Number 3,
It's pulled off here.
right in this area. Okay.
It's pulled off the bone? Or
Yes.
Hi, my name is John. I'm part of the group Diskinected, and we'll be discussing possible treatments for rotator cuff tendinopathy today.
Quick quiz. What is tendinopathy and what are the 4 muscles of the rotator cuff?
As you could see on the last clip, Kobe Bryant suffered an infraspinatus tear, and that's one of the possible conditions with rotator cuff tendinopathy. Just to go over the anatomy, the rotator cuff is composed of 4 muscles: teres minors, subscapularis, supraspinatus, and infraspinatus. And tendinopathy itself is a condition where the tendons of such muscles do not regenerate properly due to acute or chronic injury.
Hi, my name is Jason. I'm also part of Team Disconnected, and we came up with 3 learning objectives. The first one being discuss 2 treatment phases of RCT. The second one is identify 3 common conditions associated with RCT. And the last one is discuss why or why not exercise alone would be an effective treatment option for RCT.
Okay, hey guys, my name is Lawrence. As we mentioned, that there are 2 treatment options for rotator cuff tendinopathy, or 2 phases. The first phase would be the treating the condition. This would be more in line with management of pain. The second phase would be treating the cause and the associated abnormalities. So to go into more depth, the first phase of treatment would be treating the condition, and that focuses on treating the tendinopathy itself. Bruckner and Kahn mentioned that the best way to approach this is to limit activity and apply ice locally, and this is a good way to reduce pain.
So the second phase of treatment focuses on treating the cause and associated abnormalities, and is composed of 2 streams. You can either use the conservative treatment with physiotherapy and exercises and stretching, or you can use the non-conservative treatments of surgery.
And these are the signs and symptoms of rotator cuff tendinopathy according to Lewis and Littlewood et al. So symptoms will be present for greater than 3 months. Pain is during resistant testing. There will be preserved range of motion, and there will be minimal resting pain.
So for learning objective number 2, we will identify 3 underlying causes of rotator cuff tendinopathy. First one is glenohumeral instability. The second one is irregular exercise movements. And the third one is soft tissue tightness. All right, so here's Kobe Bryant before his full tear injury. And we're going to demonstrate, and he's experiencing soft tissue tightness. So we're going to demonstrate the posterior capsule stretching. So Kobe, support your affected arm with your other hand by placing your hand above your elbow joint. Bring the affected arm across your body so that you feel stretch on the lateral and posterior aspects of your shoulder. Do that in relation to pain and just wait for around 20 seconds. So now Kobe, what would you do for your glenohumeral instability?
I'm only a basketball player, man. You're the doctor.
Okay, we will do the strengthening exercises, and the one we can do today is the sternal rotation exercise. Alright, Kobe, so holding a TheraBand, bend your elbow to 90 degrees. Keep the elbow tucked and aligned with your torso, and externally rotate your arm in a backhand motion. Yes. You will repeat this exercise for 10 repetitions.
Okay, so now that we demonstrated a stretch and an exercise, we'd like all of you to break into pairs, and one person does a stretch and the other does an exercise.
Hi, I'm Diego. For our third learning objective, we'll be discussing why or why not exercise alone is an effective treatment method in treating RCT. As well, we'll be discussing why Kobe opted for surgery. Based on a Cochrane study by Grant and colleagues, evidence was found in favor of exercise therapy as a reliable treatment method for RCT. Therefore, there are a wide variety of exercises available to the patient. To name a few, external rotation of the humerus, isometric shoulder exercises, wall push-ups, and scapular stabilization are some of the options. Even though there is substantial evidence for initial conservative treatment, some individuals may still require surgery. Previous evidence has also suggested that with surgical repair, there might be long-term improvement for the patient. Although there is limited evidence supporting the immediate use of surgery in treating the patient, rather, a meta-analysis supported the use of conservative treatment first, followed by surgery if needed. A systematic review also found general improvements in pain, range of motion, and function post-operation. In Kobe's case, he presented symptoms of chronic tendinopathy for some time, as seen in the initial quote. However, due to a high pain tolerance, he continued playing until he suffered an additional acute injury. Yes, exercise may have been a reliable option for Kobe. However, due to his age, the stage of his career, and the magnitude of his tear, immediate arthroscopic surgery was a better alternative. Keep in mind, Kobe's main priority was to return to play for at least one more season before retirement.
Post quiz. What are the two phases of rotator cuff tendinopathy treatment? Name two of the three common underlying conditions with rotator cuff tendinopathy. And in Kobe's case, discuss why he chose to opt for immediate surgery. To recap, learning objective number 1. There are two phases to treat rotator cuff tendinopathy. The initial phase is to treat the tendinopathy itself to manage pain, and the second phase is to treat the underlying causes of rotator cuff tendinopathy. Learning objective number 2. Three common underlying causes of rotator cuff tendinopathy are glenohumeral instability, soft tissue tightness, and irregular exercise movement. Learning objective number 3. A review of the evidence tends to favor conservative treatment as an initial approach to treat rotator cuff tendinopathy. However, some full tear cases, such as Kobe's, may require non-conservative treatment for intended results.